Executive Constantine, it sounds like there continues to be issues with testing, getting tests, getting at-home tests in King County and throughout the region. What is your office going to do about that?
Yeah, Chris, we're in the middle of the largest surge in COVID infections in the 2-year course of this pandemic. It's impacting testing capacity, hospitalizations, and workforce, as we've seen in many places of employment across the county. King County is purchasing 700,000 home test kits. The first of those arrive next week. That will help people know for sure whether they've been infected and be able to act accordingly. We know that's not enough. We're looking forward to federal and state supplies arriving soon, but that, along with the 1.6 million high quality masks that we've been able to distribute over the last couple of weeks, will help, we hope, to lower the impact of this Omicron upsurge and get us through the next few weeks.
But the announcement today is an additional 400,000, correct?
That's right. That's right. So we had placed an order for 300,000 tests and then followed up with an order for 400,000. And our goal, of course, is to get testing into particularly those places where there are folks who are the most vulnerable, communities that may not have had as high a vaccination rate, the places where people have to be in congregate settings, all of it designed to try to reduce the number of infections that happen. And I think the pinch point really here is hospitalizations, to try to keep the hospitals from becoming overwhelmed for the sake of those who have to be treated for COVID and for all the rest of us who may have another reason we need to go in for medical care.
Yeah, that feeds into my next question is this is such a big number, but how is anybody supposed to get their hands on one of these? Obviously, it's been tough to find one at any sort of drugstore. People are having problems getting an appointment at any of the local testing sites.
So they're going to be distributed as they arrive to community-based organizations, community health centers, senior centers, libraries, and other congregate locations. And we're going to try to get them out as fairly as we can and as quickly as we can, so be available to the community.
How is this, or what is this costing the county? I mean, where are you getting these from? Because obviously it's an issue regionally.
Yeah, I am not positive about who the vendors are from whom we're getting the tests, but I do know that we are advancing the funds, and then we'll be applying for federal reimbursement for the cost of these tests. We didn't feel that we could wait until we had that federal money in hand. They are free to the public, so you will not be charged for a test. But again, we're targeting the most vulnerable communities, those places where folks are most likely to be infected. You can email OTC testing at kingcounty.gov. That's over the counter. So OTC testing at kingcounty.gov for more information on the tests, as well as about the masks that we're acquiring.
And again, you expect this flood of availability next week?
Yeah, it's going to begin next week. We're very hopeful that the federal and state governments will follow with additional resources, but even 700,000 tests in the context of a population of more than 2.3 million really can't be characterized as a flood. It is a first step. It is going to be helpful to a lot of people, but this is not the sort of thing that's going to allow us each to test ourselves every day or two. It's going to be available for the people still who need it most.
In your mind, why has it been an issue finding tests and finding available test appointments right now in the region?
I mean, folks realized that there was this Omicron surge going on. People, of course, want to be sure that they're not exposing their family and others around them. And so they've been trying to get tested, and the demand has just outstripped the supply. Some of the providers are now limiting testing to those who are showing symptoms or have a confirmed exposure to someone with COVID. I myself got one of those alerts from the state that I had been in proximity to someone with COVID. So I went and got one of the 2 remaining home tests that I had saved and took it. All clear, but it is going to be a few weeks before we reach the peak of this Omicron surge and see it decline. And I just encourage people to be cautious, to use common sense, to recognize that even if you're fully vaccinated and boosted, there may be those around you who are not able to have that same level of immunity, of protection, and that we together get through this and move on to a time which I hope will be one of much greater stability without these constant repeating surges in COVID infections.
So focused on what you just said there about a peak or a suggested peak. I mean, there's been some scientific analysis of this done locally, as you know, nationally from different colleges, research institutions. What are you being told in King County by Dr. Duchin about what this looks like here in January and going into February?
Yeah, well, not just our own public health folks, but other public health agencies as well. Saying that the peak of this is still several weeks away. You can approximate it as late January, early February, but it could be later. The point is that for most of us, becoming infected will not end up being a life-threatening challenge because we've gotten vaccinated, because we've gotten boosted, because we've done the right thing and are being careful. But for the small number who are unvaccinated still, which is about 10% or so of the King County population who are eligible. We are really concerned that they are going to overwhelm the hospitals and that's going to keep people who are needing hospitalization for a whole range of other issues from being able to get the care they need. So this is different than at the beginning of the pandemic. We know much more about the disease. We understand what we can do to prevent its transmission. Yes, this variant is more transmissible, but we have more weapons at our disposal. The fact is that hospital capacity is challenged not just because of the number of people getting infected, but because the hospital employees who've been infected can't come to work, and there are many more now being infected. So the overall hospital capacity is lower than it would have been a year or 2 ago.
And as far as the quarantine sites, the one down in Auburn, what are you hearing about just how it's being used, if it's being used, et cetera?
So we narrowed the criteria for who could be admitted to those who have actually been confirmed to have COVID, rather than people who've simply been exposed and needed to quarantine for a period of days because we're just overwhelmed with the demand. That facility, I believe, is now operating at or near capacity, which is around 100 people. So we're continuing to work to find safe places for those who cannot isolate at home because either they don't have a home or because they live in a place with lots of other folks who become infected. The public health is working with our hospitals as well to see if we can relocate folks who don't necessarily need to be in the hospital so that others who have more acute symptoms can be checked in. All of this is a challenge that will unfold over the course of weeks. And if we pull together, if we do the things we all need or we all know we can do to prevent infection, we'll be able to save lives and get back to the business of rebuilding our economy.
Is this the most valuable use of county resources, though, to have a building like this?
Well, I think it is right now. It is critical that we have a place for people who have confirmed cases of COVID to isolate so they're not infecting many others. And it has been a strategy that's been very effective here. We're now in a moment where we have this upsurge in a very infectious variant, and we have to do everything we can to prevent it from spreading even more quickly. Again, that pinch point to prevent hospitals from becoming overwhelmed. That is the critical issue in the coming weeks.